Well, these are statistics that no one wanted to talk about, let alone report or analyse. And frankly, they don't do justice to the scale of the human suffering that we're seeing across the country, let alone talking about what's happening, the indirect consequences of this pandemic, the lockdown and so on. But we can perhaps get a sense of perspective as to where we are. And it's worth just being as clear-sighted as we can at the moment. This is a terrible moment for UK mortality and for the economy as well. But let's just see where it stands. Is the UK the worst in the world? A lot of people getting very concerned about that. Let me try and show you some of the numbers. We'll start with just this one. Obviously, everyone's been focused on this question of whether we're going to hit 100,000 deaths. And actually, on most of these measures, we are there. There are various different ways of measuring this, and actually each of these measures of death are subtly different, as you'll see in a second. So, for instance, you've got the Office for National Statistics. They collect numbers on the basis of when COVID is mentioned on the death certificate, and by their measure, there are two actually here. We've got their weekly registrations, which isn't quite as up-to-date, and then you've got the more up-to-date one, which looks at daily occurrences. They're talking about getting towards about 108,000 deaths from COVID-19, and that's by the middle of last week. So we're already well beyond that, according to their more comprehensive numbers. Why the difference? I'll show you that in a second. And then you've got their weekly one I mentioned a moment ago. And then you've got this, the government dashboard. That's the one I think that most people focus on. That's where, if you've had a PCR, a positive COVID test 28 days before dying, then that's categorised as a COVID-19 death. And then you've got a different measure, excess deaths. We talked quite a lot about that, didn't we? And what might be striking to you is that excess deaths at the moment is actually below where that official COVID-19 death toll is. Now, why is that? Particularly given, you'll probably remember this from the spring. Back in the spring, excess deaths were a lot higher. It's because back in the spring, the official death toll wasn't really capturing as many deaths as were really going on in the UK, and we know that a bit from that other measure. But what's happened with this wave of the pandemic is that there are fewer deaths happening from other diseases. So fewer people are dying of other things, more people are dying of COVID-19. And when you kind of net it all off, actually you have fewer excess deaths, quite a lot fewer excess deaths in this wave than you had in the first wave. It's an important difference that's worth noting. Nonetheless, when you look at the scale of what we're talking about, we have rarely ever seen anything like this. Let's just take a look at that. I was talking about the difference between different measures. So this is the ONS one, and what we're talking about here, these lines are just showing you daily numbers of people who are sadly dying. And what you can see is there is a bit of a difference, isn't there, between these two measures. So the ONS measure a little bit higher back in the spring than that official government measure. It wasn't capturing all of what was going on back then. We weren't really testing as much. But when you take and you kind of look at the total numbers that we're talking about, so below that line, and it feels awful and reductive to put it in this way because we're talking about 100,000 deaths, but nonetheless, we have to try to get a sense of the historical perspective here. And what we can do if we do that and tot up that total number is to try to compare where we are now with previous epidemics in this country. So we'll take that and make that into kind of a bar that we're going to put on this bar graph and draw a line. So that line is just 100,000 deaths. That's just over 100,000 deaths. And what we're going to do is we're going to bring in other pandemics that we've had in this country and epidemics over the course of the last century, so you can see how they compare. So we've got the typical flu season in the 80s and the 90s, quite a lot of deaths there, around 26,000 or so in the average flu season then. That was a bad flu season. Well, this is a lot worse. It's kind of more than 4 times worse than the typical flu season. Hong Kong flu, up until now, the worst post-war epidemic in the UK. This is worse than that, worse than Asian flu in the 1950s, and worse, not worse than the Spanish influenza, I should say. The Spanish influenza, a lot worse, about 200,000 deaths from the Spanish flu. And of course, you've probably noticed it already. These are absolute numbers. Really, what you want to do is to population adjust them, because we've got a bigger population now, and work out what that number, for instance, of a standard Spanish flu would be if we had the same kind of population today, if it was the same proportion of the population. Well, that would be a lot higher, these black bars here. But what's striking is, look, Hong Kong flu would be the equivalent of about 97,000 deaths today. So this already, and Hong Kong flu was over 2 years, it was quite a long thing. This is already considerably worse than that, given that you've got no numbers continuing to mount. And that bar there, I'm afraid, is going up. COVID-19 deaths are continuing to rise. And when we compare the UK with other countries, this is something that is quite important. A lot of people have been saying the UK is doing the worst in the world in this. It's a terrible analogy to make, and I'm afraid the news is bad. It's not quite as bad as that, though. When you take the COVID death tolls for different countries and adjust by population size, well, here's what you get. These are the countries which are most affected in terms of official, and I'm going to come to there's a reason I emphasise that, official COVID-19 death tolls. Belgium, then Slovenia. Eastern Europe has had a terrible second wave. The Czech Republic there, and the UK in third place, and then Italy down a little bit below it. The UK bar going up, but I'd be very surprised if it got up to the top. So the UK is not the worst in the world, but it's certainly among the top 5 on this metric. And it's worth just underlining, it needn't have been this way. If we look at the bottom 5 in this league table, by the way, that's 145 deaths per 100,000. It's a kind of population-adjusted thing. Let's look at the bottom 5 countries in this table, and you can see, well, you can barely even see where their bars are. There are bars there, but they're so thin that you can hardly make them out. China, for instance, 0.3 deaths per 100,000. Now, a lot of people don't believe those Chinese numbers, but look at the other numbers: Thailand, Vietnam, Taiwan, and if you add other countries like New Zealand, also very low compared with where the UK is and many of these European countries. So it's been awful for much of Europe, and the UK one of the worst, but not the worst. And there is a different way of measuring this. As I say, a lot of people are sceptical about the numbers. Why, for instance, isn't Russia up there? Why are none of the South American countries, which have very high levels of COVID at the moment and have over the last year or so, why are they not there? Well, it's because their numbers aren't very reliable, those official numbers that they produce. But we can get a measure of this by looking at excess mortality, just the number of deaths in comparison to what the historical average is. And here's how things look when you take the top 10 areas where you've had high excess deaths over the past year. It's a very different picture, isn't it? Look, Peru way above many of the other countries, then Mexico, then Ecuador, then Russia, which officially has a very low COVID-19 death toll, but has an extraordinarily high number of excess deaths, suggesting that maybe excess deaths are a lot higher there. Then Belgium, then Spain, then the UK. The UK just kind of climbing towards where Spain is at the moment, and then Portugal, and then the US. Not all that far, but certainly below where the UK is right now. It's worth saying, this is kind of a moving story right now. It's going to take a while before we know for sure where the UK stands and where other countries stand, what vaccines do. And the good news is that vaccines are being distributed far faster than a lot of people expected in the UK, and cases are starting to come down. So we may have seen the worst, but unfortunately that bar is going to continue going at least a little bit higher. So we will have to see, broadly speaking, the UK among the worst, but certainly not the worst in the world. Finally, just because we tend to look at the UK as a whole, but it's worth just, kind of zooming into different areas of the country to work out which parts of the UK have been most affected, because some parts have really not had high levels of fatalities from COVID-19. I should say again, that's the level of where the UK was, 149 excess deaths per 100,000. So let's just look at this heat map at the moment, this is just England, Wales and Scotland. We don't have that detailed data for Northern Ireland. And what you can see, actually, if you look kind of closely, the darker areas here are areas where there was more excess mortality. So it's excess deaths by region, and you can see some hotspots that stick out. By the way, those black areas that I should say, those areas that we didn't have enough data for. But when you look at the dark blue areas, I'll zoom in so you can see it, there are bits that stick out. So if we zoom in to London, where you can see Newham has the highest, all of these areas, all of these parts of the UK, the highest proportion of excess deaths, 54% above the typical level in Newham. And if you look around London, you can see it's many of those London boroughs which were most affected by COVID-19 have the highest levels of mortality. And that is obviously continuing to rise at the moment. And then look just a bit further down in that league table. So you've got Oadby and Wigston. So that's just south of Leicester, 35% excess deaths. Remember, Leicester having a tough time in that second wave of the disease. But this isn't the only part of the story. There has been some parts of the country, like I say, that haven't been as badly affected. The Scilly Isles has so few cases that it's difficult for us to actually put a number on it at all. But also places within the mainland, for instance, over here, East Devon, 2% excess deaths. So there's a massive spectrum of experience. It hasn't been awful for all parts of the country But for many parts, it really has been very bad indeed. We'll continue to bring you this data, this analysis as it comes through. It is depressing to go through these numbers, but it's also important to be clear-eyed about it and to get a sense of where we stand. This is certainly a pandemic that none of us have experienced before. Hopefully we'll never experience again. And that, so far, is what the data is telling us.